Our late afternoon Friday session. Like, what day is it, right? All right, come on in. They're still filing in from the back. It's me. Must be me. Oh, silence. Wow. All right. As folks are coming in and grabbing a clicker and taking a seat, we're going to go ahead and get started with our final plenary session of the day. Thank you so much for being here. We started early this morning and had a packed room, and it's really great to see you there late in the afternoon with a packed room. We know it's been a long day, but hopefully it's been a great experience for all of you. The title of our final session is Whose Job Is It Anyway? And we promise this will be a lively, interactive discussion. Led by one of our most accomplished leaders in the field of wheeled mobility and seating. I'm honored to introduce Jean Minkel, Jeannie, affectionately Jeannie. Many of you in the room know her well from her many years of teaching and mentorship. She is a physical therapist and master clinician who has specialized in seating and wheeled mobility for over 25 years. She is currently the Senior Vice President of Independent Care System, ICS, a New York State Medicaid long-term care program. Jeannie has lectured extensively, nationally and internationally, and was awarded the Sam McFarland Mentor Award from RESNA in 2011. Similar to my introduction of Sharon this morning, she is truly an international phenomenon and a clinical mentor extraordinaire. So welcome, Jeannie. Take it away.
All right, thank you. I want to start by thanking the conference organizers. I think Friday at 4:30, after the big event last night. You really don't like me very much, do you? So really the goal this afternoon is have some fun and really look at how our practice evolves and not lose sight of opinions are important. So I want you to raise your hand if you are 31 years or younger. Well, I can report to you there are hands risen. We are very, very happy. Welcome. We want you to keep coming back. Now raise your hand if you've been coming to ISS for almost 30 years. Well, it's about an equal number of hands. So 31 years ago was 1984. Boy, I not that old. So what was new technology in 1984? The Mac. There you go. It was breakthrough technology. And for all of you that got little smartphones and you're like, what's that box? Like, this was high-tech stuff. We were really hitting the digital age. And the sports wheelchair. And this particular chair was Marilyn Hamilton's original tennis chair that she won the US Open tennis tournament with. And you can now find it in the Smithsonian Institute. I've seen it. 31 years ago was also George Orwell's predictive book of 1984, and Big Brother is watching you. Oops. In 1984, Big Brother was looking for 90, 90, 90. I can honestly tell you this was my delivery picture, and it was the perfect delivery. All children sat exactly this way in the clinic until they rolled out the door. And fortunately, we've all figured out that when you saw them in the cafeteria 3 days later, the seatbelt wasn't quite as tight, the buttocks was a little bit further back, but you could count on OT to come and put a strap on them. We've figured out that angles are important, paying attention to the body, figuring out where the body rests in space. Just 3 angles by themselves doesn't make for effective seating. We had a few other beliefs in 1984. Everyone should sit at 90, 90, 90, because sling seats stink. So we went to 90, 90 because prior to that, everybody sat like this. So it's an evolution. And we made children in particular sit in a more upright position, and then we figured out we could sit them in a more anatomically correct position. Sports chairs for young paras only. They were sports chairs. You couldn't get them paid for by medical insurance. They were tippy, and other riders would tip over. The thought of teaching somebody a wheelie was like, whoa. I remember I was a student at Ranchos Los Amigos, and it was the young paras that came back and taught the students how these newfangled chairs worked. The senior therapists were like, none of my clients should have an aluminum chair. It's not a good thing. Power chairs are for quads only. Why? Use it or lose it. The rehab principles were, if you can push, you must push. And once again, we've learned, conserve to preserve. And that came from listening to clients who said to us, I'm running out of juice. My shoulders are hurting. My back is hurting. And we sat back and we said, maybe use it or lose it isn't the be-all and end-all. So clinical practice, clinical opinions evolve. So welcome back to the present day. It's 2015. And if you're going to do a Friday afternoon at 4:30 talk, you make sure that the audience is going to have a lot of participation. So my portion is almost over. The opinions being expressed are your opinions. But in order to solicit your opinions, it's really important there is no wrong answer. We really want your opinion. And the stronger you feel, the better. That's what's really going to make this session fun and interactive. But while you can be strongly opinionated, I really ask that you're interested in sharing your opinion as well as listening to the opinion of others. It's really in listening that you think, is there an opening for me to maybe modify my opinion? So I want you to share, but I also want you to listen. So a couple of instructions, some randomly selected people. Now my question is, did those same people carry those clickers all day today? I'm quite sure they've been redistributed, but randomly selected people have a console. We're going to ask them everybody to read the statement on the screen. Push the button corresponds with your opinion. Strongly agree, somewhat disagree, and strongly disagree. Moderator's disclaimer. We are all passionate about what we do. Passions can evoke emotion. None of the following statements were designed to hurt anyone's feelings. All of the statements were designed to provoke strong opinions. Strong opinions are encouraged to be expressed. So truly, take this in the spirit of, we tried to make it as controversial as possible because the idea is, let's really hear the opinion. And the more range we have, the more fun it's going to be. So let's have some fun. Can we go to statement number 1? So you hit the button A if you strongly agree with this statement, B if you somewhat agree with this statement, C if you somewhat disagree with this statement, and D if you strongly disagree. And the polling's coming in. All right, looks like everybody's put a vote in, and the results are, all right. We have 18% for strongly agree. We have 31% for somewhat agree. We have 26% for somewhat disagree, and 24% for strongly disagree. So I need a couple of brave volunteers. You didn't have to have a clicker, but if you had a strong opinion on either end, somebody that looked at this question and said, I strongly agree, and somebody else who strongly disagreed, are you willing to volunteer? You can walk up to the aisle mic, or we have some mics that will roam. The question is, what was your opinion, and why do you have that opinion? There's one coming.
See if these are working. Can we get the tabletop mics working? Tabletop mics? I need a microphone.
There we go.
All right. This is even better, like Oprah. Here you go. Thank you.
Well, my colleague and I discussed it just briefly, and we strongly agree because we do work closely with our doctors often to get some interventions that we feel are going to help us get the client better positioned. For instance, we work in a hospital with brain injury patients, high tone, which many of you have seen. Sometimes we have to talk to the doc about his pharmaceutical intervention, whether it's a baclofen pump or whatever. And if it weren't for that, we'd never get the guy seated.
Great, thank you. That's exactly what we're looking for.
Exactly.
Somebody brave enough to say they strongly disagree.
All right,
All
here
right.
All the doctors we work with want to do as little as possible. They do not want to be a key member of the team.
we go. All right, there's there's stable mics in the center, and we have mobile mics. So if you're close enough to a mic, jump up there.
And I'm just going to give a quick disclaimer. We're going to take 2 more comments because we had a bunch of other statements and we really want to keep this going.
I think it depends on the physician. I work closely, or we work with a physiatrist who doesn't know a whole lot about seating, but pretends that he does. And so he vetoes a lot of the stuff that would be really useful for clients without any reason.
If the question said the physician should be a key member and it would turn out better, I would say strongly agree, because it does. But in most of the cases, the physician's not involved. They only want to get the signature on the last documents and don't bother me for anything else about the wording.
Excellent point. Okay, we're going to go to the next question. Next polling question. Consumers should be in control of the decision-making process only if they're private pay. A little laughter is a good thing when you're standing up here. So the polls are coming in. And the 2015 results are, so we have a very consumer-centric crowd here. So now this could be interpreted very interestingly. If you strongly disagree with the statement, are you saying that consumers should not be in control of the decision-making process? They should be in control all the time. So just to test, Andy, quick, go to the next question. So I'm going to ask you to revote. Consumers should be in control of the decision-making process. Little slower in the responses. Okie doke, and the response is? strongly agree, somewhat agree, somewhat disagree, and strongly disagree. Now, what's interesting is that there's slightly different results. So we're going to, not to convolute the discussion, we're going to focus on the consumer's decision, the consumer's role in the decision-making process. So who would like to voice why they voted the way they did? Hey, Kendra, can you, or actually, you can get to the mic real quick.
She can get there faster than me.
I voted strongly agree because I interpret it as being in control of the decision-making process doesn't necessarily mean that they get what they want, but they should still be in control of the process, which means being given all of the available information, some of which is about funding limitations. Because if they don't feel like they're in control of that, then they're not going to use whatever is recommended anyway.
Thank you. There's a brave hand over here.
Jump up to that
Oh,
microphone.
can you hop up to the mic?
Come on up. Move it, move it.
I chose strongly agree because, there we go. Being part of the decision-making process doesn't mean they get what they want, like she said, but it does mean they always have the decision to just go find somebody else.
So let me ask you a question, folks. This is not in the poll. If we ask consumers, do they feel they are in control of the decision-making process? I would say if these are really part of our belief system, we really want to look at our processes and ask ourselves, are we really giving consumers as much control of the decision-making by virtue of giving them as much information? But we'll delve a little deeper as we go along. Okay, go ahead, Andy. The next question is, a manual wheelchair is the most appropriate option for a newly injured person with a high thoracic level of injury. Okie doke, Andy, let's go to the results. So strongly agree is about 8%. Somewhat agree is 46%, so we're almost got half there. Somewhat disagree, 30%. And strongly disagree, 17%. A little more variety. Any brave souls? Particularly in the somewhat agree. I heard it depends coming out of. So how did you vote? Why? And what are some of the depends factors? Different depends than what Simon was talking about. Can you get to the side mic? Is that pot? No. Can we get a mic up?
Who is it?
Oh,
Oh,
wait,
up front,
sorry.
up front. No. Oh, here we go.
And while we're coming up front, I'm going to bet that Mary Ellen is not a strongly disagreeer. So I'm going to ask a strongly disagreeer to think about raising their hand.
I would say it depends on their premorbid state of fitness and their comorbidities.
And in particular, which comorbidities would you be?
I'd be thinking about brain injury, upper extremity strength fractures, nerve impingement, other kinds of things that would affect propulsion.
Excellent, thank you.
Heart disease.
Any strongly disagreeers willing to raise their hand? 17% of you are out there.
They're hiding. They're all
I
hiding.
don't know who you are, but I would call on you if I
No,
did.
your clickers are tagged. We really do know who you are. No, just kidding.
Only because it looks like a Resna ATP question.
Did everybody hear that? Can you say it again?
Actually, this is my colleague's comment. I'm giving it for her while she's working on her, her extroversion skills. It looks like a RESNA ATP question where there isn't enough information, but when I see it, I would say that it appears to suppose that you could somehow guess what.
We're going to ask you to...
Maybe they turned you down. I don't know.
All right, turn this one down. The question makes it look like you could make some determination without knowing more information. So my first response is I disagree with that altogether.
But I can tell you, in 1984, there would have been a whole lot of strongly agrees. People with a thoracic level injury got a manual chair. It's so cool now to see it depends, and that we think a bit more holistically about the person. It used to be the diagnosis led you to this device, and your choice was palm green or blue. Next question, Andy. Whoops. All PTs and OTs are qualified to perform a basic seating and mobility assessment.
Listen to the noise. Keep yourself quiet. Vote.
Oh, there's a fairly rapid response coming in on this one.
Okay, you can still talk. You can talk. I'll give it to you. Yeah.
Okay, Andy, our results. Whoa. Okay, I'm going to apply to the combined sections meeting next year, the APTA conference, and ask the same question. I'll bring you back the results.
So just
Now-
as a reminder, everyone is allowed to speak your opinion. If you don't have a clicker, that's okay. Everyone has comments. Like these people were going to tackle me over here.
So according to our professional college, which doesn't allow us to actually have a specialty, apparently according to them, everybody who is registered with the College of Occupational Therapy of Ontario is qualified to perform a basic seating and mobility assessment, whether we, their colleagues, think they are or not.
Thank you for sharing our international struggle. Others?
As a physical therapist, our profession.
Can you hold one quick sec? Make sure this mic is up. Just step a little closer.
As physical therapists, our profession is becoming very subspecialized. So you've got folks who are specializing in wound care, sports medicine. So no way would all of them be qualified.
Thank you again. However, our American Physical Therapy Association reports to the government that all physical therapists are qualified to perform a basic seating and mobility assessment. And so does the AOTA. So, I mean, we picked this question really to let you guys know we love that you guys are specialized.
All right, we got some commentary over here.
You know, as a therapist, I think fundamentally the problem begins in academia and the lack of the educational programs truly educating the students on what specialized practice is. And then they go out believing they have skill sets that they truly haven't been taught. And I think that's our responsibilities as clinicians when I go out and lecture at the institutions in the state that I'm from, is really directed towards making them recognize this is a specialty area of practice and that you do have to do more training if it's really what you're going to do. And I think that's where our responsibility is to tap better into those programs and provide that education.
Excellent. Thank you. Thank you. One more comment behind you there, Kendra.
Yep.
I feel strongly that OTs and PTs are qualified to know when to ask for help and to get some help to figure out how to best help the client.
Excellent. Thank you.
We had one more over here, Jean.
Last one over here. Thank you.
I guess I'm part of the 3% as an occupational therapist and a consumer. And I think the important thing that people forget in this room is that it says basic. And that we all have, as occupational therapists and athletic trainers even for that matter, which I'm one of those as well, we have the basic education. And the AOTA has been very clear at saying, you have the basic education. You are not an expert. If you want to declare yourself an expert to the government and do what we're doing in this room, you got to come do this. But we all have the basic education and the skill set to do that. The question is, do you develop them?
Excellent.
And unfortunately, I meet too many that don't.
Yep. Thank you for speaking up for the 3%. I greatly appreciate it. So, Andy, our next question. Only therapists should be hands-on during the MAT assessment.
I love the low-level rumbling.
Nobody said they couldn't be leading and loading.
It's kind of like the sound of thinking. It's like the sound of thinking, rumble, 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 rumble.
Okie doke. I think we're good. So we have 7% strongly agree, 14% somewhat agree, 27% somewhat disagree, and 52% strongly disagree. Any opinions that want to be expressed?
Here we go.
As an ATP, I felt like it was time for us to stand up and say thank you to the therapists. As long as we as ATPs understand the respondent superior role that we are, the relationship with the therapist, I know there's so many kids and stuff that we've seen over the years, you can't do it with one set of hands. You know, if a therapist had 8 hands, got it. But yeah, I don't think there's any way that any one set of hands can do some of these folks. So.
Really awesome. Did everybody hear the comment that in addition to working collaboratively, having another set of hands is really helpful?
Okay, so I'm an engineer, and so I don't really know a lot about MAT assessments, but I do feel like with the chaperoning of a therapist, the only way we're really going to learn how to make effective and design effective assistive technology is if the therapist let us do something. So,
yay!
It's really uncomfortable, but like it really helps to enhance our ability to implement what we know effectively.
So if you're not invited to put your hands on, ask to put your hands on. Thank you. Boy,
Who just spoke about how I have to do the evaluation by myself for the first visit due to reimbursement issues. I keep it 1 hour. I do the MAT assessment during that visit. I'm doing it alone. I don't like doing it alone when I need that extra pair of hands. But I get a feel for the person. I have the family help, whoever can come in and help me to get it done. Then when they come back for their second visit, I want that supplier to have his or her hands on that patient too, because I want to say, here's what I need, here's what it takes. I want you to feel it so you can help determine the products needed.
awesome. Thank you, thank you. Last one?
I'm of the same opinion, but I had already gotten up to say it. I'm an ATP and a PT, but I work for a vendor, and I think when we're making decisions, they're complex decisions, and I know I think better if I have my hands on the patient, and I think me and the therapist and the patient and the family can have much more fruitful discussions if there are more heads involved and we can all offer our expertise.
Excellent. Great. Thank you, thank you. Andy, next question. A seating assessment can be done while the person is sitting in the current wheelchair. Clearly, I posed my questions prior to Sharon Pratt's discussion, or Sutherland, this morning. Okie doke. So, a seating assessment can be done while the person sitting in the wheelchair. We have almost 70% of our folks strongly disagree. It would be a little hard to, but I am curious, in the somewhat agree, somewhat disagree. Someone want to speak to?
Someone back here?
So I do always get someone out of their chair to do the MAT assessment, but there are strategic things that you have to watch how that person uses the environment of that chair. How do they hold on with, to lean to the side? Do they use the armrest? Do they not? Do they hook their arm? So that those are the cues that you need to look at. So that's why I answered in that way.
Excellent, excellent. So you don't want the chair in another room. You need it to be a part of the assessment. We have a hand up here. Running. Hold on, we have one here, and then we have to go back to the back of the corner of the. Sorry. Oh, thanks, Michelle.
I normally, is this on now?
I think.
Okay, there it is. I said somewhat agree because I have worked with some people who are verbal, know a lot about their own needs, and even with 5 years or 8 years, I'm doing the 4th chair for that person because I've worked with them for so many years, and it's very difficult for them to get out of the chair. And in those cases, I can do a few things. I can feel things with my hands but ordinarily, I very much agree with Sharon.
So a reason is a familiarity with somebody, using your hands with somebody in a system, and what's kind of implied in that was too that you were familiar with the system they were in, assuming that you had built it. So there's a unity there that you're assessing the whole picture.
I strongly agree. It's not the answer, but it's part of the problem. If I see a little old lady in a big chair that she's falling over and she's got scoliosis, how do I know it's the chair that's causing that issue? So we need to look at the person in their current equipment.
Absolutely. So I think one of the big takeaways here is the and. We need to look at the person in the chair, we need to look at the chair, and we need to take the person out of the chair. That's all part of that comprehensive assessment. Terrific. Andy. It is a waste of time to show a consumer products that her insurance has already denied for others. Responses are coming in. A couple thoughtful folks. Okay, Andy. So, 1% strongly agree that it's a waste of time. 7% somewhat agree. 30% strongly disagree. Somewhat disagree. And 62% strongly disagree that it's a waste of time to show somebody product that their insurance has denied. Any opinions? Range?
We got one stepping up to the mic here. We got two. There we go. There we go.
Now, if this is on.
Hold on one second.
I think it's our responsibility to provide all of the options to consumers and allow them to make choices. They are their own advocates to the payer sources. It's our responsibility to provide all the options to the physicians, to the therapists. That's our job as ATPs. So they can advocate to themselves, to the payer sources, and sometimes come up with funding themselves. So just because somebody denied it once doesn't mean they'll deny it again. And it's the only way we move technology forward.
Excellent. So the point was giving people information, particularly the end users, allows them to make the decisions, particularly around how they want to spend their resources.
Once the insurance companies disagree for one client does not mean they will disagree for the second. And are we really as professionals going to allow and continue allowing insurance companies always to dictate us, or will we look into a consumer advocacy also in us, along with the professionalism, to go and ask questions and appeal to the insurance companies?
Thank you. So I think we all share with, unfortunately, a reality today, particularly in the United States, is the funding does drive a lot of the decision making. And we can certainly share with people, this is what's available with the least out-of-pocket expense to you, but this is what is available if you can find other resources.
The results of that little survey are really encouraging, because I remember, and a lot of you were probably here more than 10 years ago when we had the debate on should you tell people about stuff you don't think would get paid for, and I think you saying you can't always get what you want.
It's true.
And at that time, what stunned me was that more than half the audience said, I wouldn't tell somebody about things I don't think they can get paid for. And it seems like there's been a big shift in that, so that's really good news.
Yes, we evolve in our thinking. All right. I'd like to keep going because we have some really good questions. A person with a stage 4 wound should never be allowed to sit in a wheelchair while the wound is open. We can assume it's under initial tuberosity. Phew. Okay, Andy. So, those who agree, 4% feel we should never sit somebody with a stage 4 wound. 10% somewhat agree. 36% somewhat disagree. And 49% strongly disagree. Any opinion? Here we go.
We're just wondering if the 4%, what that number would be if this same question was asked of some wound care nurses and the physicians that we said were key to the seating and mobility prescription.
So the comment was, what would the response be if we were a group of wound care nurses or those key physicians on our seating and mobility teams? Clearly, professionally, there's some differences of opinion here. Others? Let me ask, can someone think of an occasion where you absolutely would tell somebody not to be sitting on the open wound? Oh, go ahead. Come on up. You can state your opinion as you had it.
I would say with the arrival of the prone power table that was being demonstrated in one of our presentations today, it's looking a lot more likely.
Excellent. So the comment was that during the show and during one of the presentations, a motorized prone cart was shown, and just illustrating that there's another mobility device to allow someone to get around and not be weight-bearing on their buttocks. Okie doke. Andy, a person who is legally blind is not a candidate for power mobility. Mumble, mumble. Okie doke, Andy, we can. Aha. 2% strongly agree, 7% somewhat agree, 25% somewhat disagree, and 66% strongly disagree. Any comments? Can you hop up and grab that aisle? So while he's going over, go ahead. Oops.
This has been a problem for many years in our industry, but for those that strongly agree, why do we allow the legally blind to walk?
Exactly.
I don't know if the product is still available, but I actually did a power wheelchair for a legally blind person that was paid for by the New York State Medicaid system. It was back in the, I think it was the 90s, I can't remember anymore, Gene. But there was a sonar device that was available. She had shadow vision, and she was an excellent driver.
Very good. Jenny, teacher. Is Jenny's mic working? Oh, there we go.
At one of the clinics that I worked at, we actually had a lady come in that drove with seeing eye dog using power mobility. So I don't think I would have thought about that initially, but anything's possible.
Very cool. So consumers can teach us things.
I stalked a young lady at the shopping mall who was driving with her cane, and I asked her what was her Roman Lansky CVI level, and she said she couldn't see anything, even light or dark. So I said, "So Sarah, do you drive real slow?" She said, "No, Ginny, I tap real fast."
Ah! So Jenny stalked a woman at the mall, and she asked if she drove really slow. She was completely blind, and she said, "No, Jenny, I tap really fast." Clearly, teaching orienteering skills to an ambulatory person are exactly the same skills we can teach people who are using wheeled mobility devices. So, again, I think this also really represents a very cool evolution. Years ago, you had to be a candidate. You had to have visual skills. Andy. Consumers should not be allowed to have a personal programmer for their power chair. And the results are, a little more spread out. So 19% strongly agree, 35% somewhat agree, 29% somewhat disagree, and 17% strongly disagree. We'd love to hear a range of opinions on this one.
So there was a day when I would have said, don't give an end user I'm a supplier, I'm an occupational therapist, and I work for a vendor, and I would have said, please don't ever ask me for it because I don't want to tell you no, but the chances of you like really making it worse in the end and us having to come out anyway and then try to figure out what's been changed can just be too much of a mess. And it can be avoided, so just call us if you need us to do something. But I met a gentleman earlier last year, and he was one of a kind, and his personality would have made anybody decide that it's just best to give the guy the programmer because he actually knows more about programming than probably we do because he has spent like an inordinate amount of time over the course of the last 6 months learning how to use a programmer and learning more about the programming capabilities than probably somebody who does this for a living. So that was when I was like, can I get a programmer for this guy? and I did, and I gave it to him, and he used it successfully and proved probably a lot of people in this room wrong. So
We'll invite him back to do a programming class.
yeah, I'm serious. Absolutely.
And there are a wider range of opinions here, folks.
Oh, I say this often. So I am currently ambulating, but in the future I will probably be a power user, and my vendor will definitely have to give me a programmer.
Ah! Near.
I'm willing to be influenced and change my opinion. I want to know what the liability rider on this thing's going to look like. You know, what are we going to get somebody to sign?
So, really good question. The mic needs to come up. there's translations going on, so that's why we're waiting for mics.
If parents can program the insulin pump for their kids, if a prosthetic user with a microprocessor controlled knee can reprogram the knee for the shape of the ground under their feet or the task they're facing, then why not? But, you know, there's a cost to having a programmer, so it depends. But it seems to me that I should have the choice if I feel that I'm willing to take on the liability for that.
Mm-hmm. Excellent, thank you. I think we have, oh, not going to a mic.
Power wheelchair user, for a consumer, a power wheelchair is like a car. If we can maintain and program and do things with our car, why not them?
Thank you. My one comeback, though, will be my car is way more complicated for me to do any basic mechanics anymore. Used to be able to do a lot more, and now you have to go and get that plugged in. We got one more? Great.
One more.
As a ATP and a lead tech, there's parameters inside programming that take extensive training to understand. You know, when you start talking high torque. Okay, torque on a power chair is very different than what the conventional torque is, and they can start cranking it up. And you know, we have a client that does that. These chairs can become very, very dangerous if you don't know what you're doing. You know, there's chairs out here now with 7.5 mile-an-hour motors. I mean, if they go jacking it up, jacking the acceleration, it can literally throw them out of the chair.
Yeah.
So.
Thank you. So there's potential for more harm, particularly if someone isn't aware of all the parameters and their impact.
It's okay.
I work at the Veterans Hospital in San Francisco, and there's no way I'm giving my guys a programmer. No way. It doesn't even come with a programmer, right? There's.
Awesome, thanks. One last one. Oop.
Okay, they're both from. Okay, they're both.
Hi, I work at the VA in Augusta, Georgia, and I have given some of my people a programmer, but I only do it if I feel like there's somebody who's responsible with it, if they are experienced users, and I spend time teaching them how to use the programmer too. So don't give up on your veterans.
And one.
Isn't Augusta all flat and everything?
Jeannie, I have someone back here.
Okie doke.
Just really quickly, I mean, as with anything, you're going to be documenting and you're going to be giving the reasoning behind why you're giving this person the programmer. So in that case, I mean, liability isn't as much of an issue. I mean, at some point, some people have to, and they want to take responsibility and ownership for their care. And I mean, that's an awesome thing that we get to give them.
Awesome. Thank you. Yep.
Am I here? Okay. Bottom line is you can buy them on eBay, so it's out of our control.
Bottom line, you can buy them on eBay. Whole different story. Okay, Andy, next question. A well-designed seating system will prevent spinal deformity. And the results are strongly agree, 4%, somewhat agree, 30%, somewhat disagree, 36%, strongly disagree, 30%. A little bit broader. Some opinions. It might be faster for you to go over there. Thanks.
there are so many things that can happen outside of the wheelchair seating system, particularly with all the hours every day and every night that people spend not sitting in their chair, that we have to look at a lot of other things besides just the seating system.
Awesome, thank you. Yep.
A tool is only as good as how you use it. So if the person isn't positioned properly, it's not going to do its job. If you're not going to tighten the seat belt so they're locked in properly, forget about anything as far as alignment.
Can I put you on the spot for 1 second?
Sure.
A well-designed and properly used seating system will prevent spinal deformity.
That's a really good question. Yeah, right, I should. Yes.
You could pick one of the choices. You can somewhat agree.
I would somewhat agree to that. I think, as with most of the questions here, it depends. Especially in a PEDS population, which I work in, these kids are constantly changing. Their functions are constantly changing, in addition to growth. So if that system's going to grow with them, assuming there are no skin issues or anything like that, I would agree.
Can help. Thank you.
I've worked with clients that have had rods put into their back and have bent their rods. That hasn't prevented deformities. I'm not sure a seating system could stop.
Yep, you're on.
Yeah. I would strongly, even if it's well designed and the person's, perfectly positioned, I would still strongly disagree because of what Tamara said, number one, because people don't spend all day in their seating systems. And also, we don't have the research to support that. I mean, you could be in a, perfectly designed, custom-contoured seating system 24 hours a day, and we still don't have the research to show that that's going to prevent spinal deformity. So we like to think that it does help, at least, but we don't know that.
Yeah, I was just going to say exactly the same thing. It depends. Their nighttime lying, what position they're in standing. Most of our clients don't stay 24 hours, 7 days a week in a wheelchair or a sitting system, so it's 24-hour postural management.
And hopefully we don't want anyone sitting in their wheelchair 24 hours a day. And yes?
I think it has to be a comprehensive approach. It has to be antispasmodic medication, surgery, many other things that have to come into play besides the seating system. And I think we made great gains, tremendous gains, but we aren't there perfectly yet.
Thank you.
Jeannie, back here. Jeannie, back here.
I was just going to say, if we could change the sentence a little bit, I believe that it can help prevent some spinal deformity or stop it from getting worse, even though they're not in it 24/7.
We can change many statements. The idea was stake your nail in the sand. Last one over here. You may be faster. You can't. Okay, never mind. Where did our second mic go?
Here we go. I got one. You guys are.
I thought Kendra had made the escape to the bar, and it's not quite wine time.
I really
yet.
tried. That's where yeah.
I think the one thing we have to remember is that there are spinal deformities that develop because of wheelchairs. And the main thing that I'm talking about, when Sharon talked this morning, about there are, especially in adults, individuals who develop a hip extension contracture, and then they develop the spinal deformity, and if the wheelchair doesn't accommodate that, or the sling seats, there are, when we've taught courses over the years, the one things we teach is that if we do this, then we can actually cause this problem. So it really kind of depends.
It depends. I will also tell you, in 1994, I wrote many a letter of justification that whatever I was doing with plywood and foam was preventing postural deformity. We can pretty much say it takes a whole lot more than just that lateral support. Next question. Oh, yep.
Yeah, I guess
The thing that I would like to say to address that previous question was, would a poorly designed seating system cause spinal deformity?
But that was one of the comments over here was.
Okay, I didn't catch that.
In combination with other postural deformities that aren't being accommodated, the answer is definitely a yes. I am going to go on to the next question. Children who use wheelchairs will not be interested in walking. And the results are? Okay, I think we have a biased audience here. So clearly the results are 86% strongly disagree with this statement. As we have lots of statements, seems like there's a lot of uniformity around that one. Let's go to the next question. Consumers should understand that complex rehab suppliers work on very small profit margins. Stake your opinion. Oh. Slightly slower responses. You got to commit, ladies. We're going to close the polls. So 21% strongly agree, 25% somewhat agree, 14% somewhat disagree, and 40% strongly disagree. So I'd like some opinions from the floor. And if you wouldn't mind on this one, if you tell us how you voted and why.
Well, if you want to be thought of as a greasy salesman, talk profit margins with your customers. But I've never had a medical procedure, my wife's never had a medical procedure that I talked with the doctor about profit margin or anything else. So if you want to be considered a medical professional, I wouldn't talk profit margin.
All right.
I voted disagree because consumers don't care what is our profit margin. They have to be in the center themselves. And they are not worried what you make. They want to make sure that they are taken care.
Just hold 1 second. As a consumer who is not paying for the item, does it influence your... It doesn't.
Because consumers are still paying indirectly as a form of premium, so they don't care.
I think you're good.
I'm a clinician and not a supplier. I've kind of evolved a little bit in my thinking about this, and I still go back and forth, but I think that some of the problems we're finding ourselves in now in the United States are because so many people don't realize how much stuff costs. And you once coined a term, I heard you say it, Jeannie, about resource allocation, and about how sometimes money can be found for big flat screen TVs, but not for perhaps a small accessory on their chair. And it's a very difficult question, but I think as long as people are kept in the dark about what things cost, it's going to be difficult for us to make the systems change that we need to make for funding.
Thank you. All right. Hold on, let me just see if the mic...
I chose somewhat agree because although consumers don't have any need to know what these profit margins are, I found in certain situations giving some light ideas of what they're like, not specifics, has helped them to be more level-headed and reasonable with what they demand.
Thank you.
I'm a clinician, and I voted somewhat agree because I don't think that they should always be, needing to understand that. But I find myself frequently in the position where I'm defending my very good suppliers when the consumers are having very high expectations. And I feel the need to kind of get them, their brain wrapped around the reality of the situation, because that's also the only way to get the systems changed and get the consumers involved in understanding what the problem is and speak up.
Thank you.
Jeannie.
Yep.
Jeannie, I was going to say that I'm a clinician, and part of this is that this is the reality of the situation. But as a clinician, I need to support my vendors to stay in business, because I need good vendors in business, not out of business. So I try to help and explain it, as well, just so they have context. Because I think as the clinicians who have maybe more of a relationship, when they're new injuries, if we don't set the context for their utilization of that service, then our vendors have no chance. And I think that's our professional responsibility to do.
Thank you. One here.
Earlier today, Claudia was talking about don't be shy. And one full section of the Cook and Hussey book that I read talked about making sure that your consumers understand economies of scale. While I'm choosing to interpret profit margins a little more broadly than, dude, I didn't make any money on this chair, so shut up. It's about being able to answer the question. So much of what we do is a one-off. You start talking to a car manufacturer about how much it costs to make a one-off of an electric Tesla, it becomes a very more expensive device.
Great, thank you. One last comment here.
So I'm an OT that crossed over to become to the dark side, to become a provider. Not really the dark side. I love you guys. And while I was a distributor, or while I was a provider, I went to SELA and advocated for our industry. I went to my state and advocated, saying that you guys are going to chase guys like me out of the industry, people that are making a real difference, people that are fixing problems instead of causing problems. And every time I said that, I never actually believed I would ever leave. But I did. I went back, and I'm still part of the industry, but I'm back as an OT. And I feel like I'm in the right place right now. But at the time when I was saying that, I never believed it. And I think that whenever people understand the decision-making process, when our customers understand why, but this is the chair that I had last time. I want this one, and I'm like, I want you to have that one too. And so here's what you need to understand: these things have been cut. The chairs that are being distributed as the go-to chair now, a manufacturer brought that same chair into my office in 2003 when I was first in sales, I would have said, get that chair out of them. Don't ever bring anything that looks like that in here again. And then before I left, I'm like, well, this is the chair that you get. And so I think it's healthy that our patients, when appropriate, understand, profit margins and how they affect them and us and Medicare and everybody.
Terrific, thank you. Okay.
I'm an OT as well as a supplier, and I want to say that when I go to the doctor, he gets paid for my visit. And when my patients come to the OT or the PT that they're seeing, they're not seen unless their registration goes through and their insurance goes through, and they can get paid for the visit. And once I've sold a chair, I have to pay the manufacturer who I purchased the chair from for the chair. And yet universally, things are moving in a direction where the supplier is being asked over and over again to provide more and more for less and less. And I understand it's not about the consumer. I want to give the consumers every single thing they need. My heart is in the right place. But I think we're in a different era. We need to educate people on what it costs, on what we can supply, what they're very, very able to purchase if they'd like to, and make it fair for everybody.
Thank you. So one parting comment before we close this one.
Sorry, one over here.
Thank you.
Jeannie, I guess as a consumer, I would replace complex rehab suppliers with auto dealers and see how people in the room would feel. You know, there were a lot of good comments, and education is important, but as a consumer and a professional, you know, I don't care what the dealer's making from the perspective that, you know, he can't pay his bills. I care whether he stays in business to help me or not.
Yep, we hope that that's what you care about.
Right. But I think the more important component is trying to make this transition to a consumer-driven industry as opposed to a payer-driven industry. And unless we continue to fight back, both as educated consumers and as professionals, there's not going to be that switch.
Great. Thank you. Oh, my closing comment is an old dear friend, David Miller, once said, "Profit is not a four-letter word, but loss is." And we don't want to lose any more complex rehab suppliers. Next question. Consumer choice is essential for effective service delivery. In the spirit of time, just because we have a bunch of other stuff, I think we've talked a lot about consumer choice. I'd like to go on to the next question if we can, Andy. Is that possible? Whoop. Okay, we got a strong response. Working from a formulary is essential to stay in business in the current reimbursement climate. And to people that may not know what a formulary is, there's a reduced number of choices in a particular price. So a hit list, some people may call it. All right, Andy, why don't we close the poll? 17% strongly agree, 37% somewhat agree, 27% somewhat disagree, and 18% strongly disagree. So I'm going to ask for two opinions describing the formulary in the current reimbursement market. Well, it must be really controversial if nobody wants to say anything.
I think that if we're talking about consumer power, then yes, this applies, especially in the competitive bid areas. We are in danger of being in a position where we're forced to go to formularies, but for now, I think we can still be more open.
Thank you.
Speaking from a manufacturer's point of view, it's I think it's putting the onus on, we're just dealing to the government's lowest denominator. And they're going to keep going down and down, and we're going to always be going down to the lowest denominator in the lowest category. I think there's alternatives, there's ways of getting around it by using samples, by direct purchase, by internet fundraising, things like that. So I think I guard against always going to the denominator.
10 miles. Awesome, thank you. I am going to move us along, believe it or not, tick, tick, tick. Andy, we have next question. I'm actually going to go to the second to last question for me. Oh, should we do that one? The reward of the seating and mobility profession is the difference we make in people's lives. What's that? Yeah. And the results are, ta-da! Now, there was a wonderful comment up the front of the room. It says, it is the reward, but is that all it should be? Or should that be the only reward? I think what we really want to share with everybody, we share a passion, there is no doubt. It's a complicated business. And I think what we've heard today is we've made a lot of evolutionary changes in clinical practice. I think we've become much, much more aware of a profession of consumer choice, the consumer role, and we're watching the evolution. And kind of closing the loop with Simon's talk on what are the systems change, partnering with the consumers to influence that change is probably one of the most important takeaways we can take from today's talk. I have one last question, as it really is getting close to wine time. I need everybody to vote. This is a recorded session. This was the most fun session I attended at ISS. But Andy, I got to see the results. I'm a very visual person. So thanks so much. It was really, really a lot of fun, and the technology made a crazy idea actually come to fruition. And having something that really we could get a diversity of opinion shared in a big room like this was just terrific. So thank you.